So we are on our 19th roundtable today from NJH, and it's been quite a journey where all of us share so much experience, and we share it with everyone, all of you, and share it amongst ourselves also. So we are very happy to be doing these roundtables and doing webinars. And NJH is going on from strength to strength. The issues are coming out beautifully every month, on the dot. And this last issue is also fantastic. Very good cases. And this topic is a little unusual of today's roundtable. And we have a panel also, which is, unusual in the sense of putting them together. So when we think of occupational disease, we normally always think of somebody who's working in the mines, working in factories, and they get trouble and all these kind of serious ailments and all. But we have to also broaden our view and think of all the things we can do to normal people, to normal everyday life, where we have trouble and where whatever trouble we have, it probably creates a problem for our occupation. Okay. For example, if I have, as a doctor, if I have a voice problem, I have a node in the larynx, then that would become for me an occupational hazard. So it can become an occupational problem. So things like that I'm talking about, and where we have to deal with all these. So people are going to deal with 4-5 conditions and common conditions, which can really help all of us to look at occupational hazards in a different kind of a way, and we talk about it. So let me introduce my panel. We have Dr. C.H. Asrani. All of us now don't need any introduction, from Bombay. He is a family practitioner and very, very well equipped because he's done family medicine specialty. Then we have Dr. Lata from Bangalore, who has done a lot of work on both fields, private and charitable, and has a lot of experience. And we have Dr. Anjali from London. So, it's a very all-world coverage kind of. So she, though a homeopath, she deals lots in other modalities of treatment, which she's going to tell us for each of the conditions we discussed. So I throw the open floor to Dr. Asrani, who is always our opening batsman, and he will tell us how he looks at occupational disease.
Good evening, friends. As is the NJH tradition, without wasting much time, I'll start with the first group of complaints, which is very common in primary care practice. Musculoskeletal problems due to abuse of our own body, largely the spine. This problem started, it's been there always, people who work on computers, people who watch a lot of video on mobile, neck pain. In COVID, it started that, people were busy the whole day doing household work as well as their professional work. So in the night, they would lie down and use the mobile in lying down position for hours together. And then morning when they get up, they get dizziness and the thought of vertigo. So cervical abuse is a major issue. And since we doctors know spine is one organ, cervical abuse can also give you problem in the lower back and pain there. So my job is to relieve the pain and guide the patient on how not to get it again. I will give a simple thing, like this morning only I had a patient who said, I work 8 hours on the computer. So we say every hour you take your left hand and squeeze the shoulder blade on the right side 5 times. Then opposite hand, the similar activity 5 times. With the right hand, hold the muscles in the nape of the neck and squeeze 5 times. Then wherever you are sitting, there are 4 corners, up, 2 down. So look up, look this side, look down, and again look down. You moved your neck once every hour, and this will avoid the problem. This is youngsters where there is no need to do an X-ray and everything else. So commonest neck pain and lower back pain. A lady in the house, her job is working in the house, sweeping, swabbing, cooking, and she cannot bend and pick up things. Then I have to guide her how to bend from the knees, not from the waist. So all these advices plus the necessary remedies I'll give. Hand it over to Lata.
So for neck remedies, we have used, if it is due to spondylitis causing this numbness and radiations, Lacananthus is a good remedy. And there are other remedies like bryonia, where it undergoes extreme stiffness and the patient feels better when you just relax the muscle, and slightest movement aggravates the pain. Similar to causticum, these are acute remedies. So very often we find, like you said, if it is an occupational condition and it is an acute related illness, then remedies like causticum, bryonia, Lacananthus, rustox, sometimes even gelsemium if they have a headache. These are the remedies that are good for the neck. Some small tip that I have also found useful: if suppose there is a rustox-like symptoms, like initial movement worsens and then you continue your movement and you feel better, I have even given rustox mother tincture with coconut oil and asked them to apply externally than internal, and it works quite fast. It relieves the spasms here, along with a little bit of ice pack, although I do believe that people, orthopedic surgeons have difference in views of hot pack and cold pack. But whatever the patient is comfortable with, I think we can continue that pack. And this application, local application of your indicated remedy can also benefit immediately relieving the spasms. And I think generally neck pains and all get better by these gentle massages. So that is one tip that I thought is useful. In fact, our CH in our community, one of the activities the female health workers was to make these ointments with glycerin, rustox, arnica, bryonia, and depending on the indications of the symptoms, they used to use this application. Now for the lower back pain, we have used nephilim, we have used rustox, tellurium. These are all spondylitis related. If it is just stiffness and there is body back stiffness, Simicif yoga is a very good remedy, along with other symptoms of the mind if they are under anxiety, depression, and they have these fibromyalgia like stiffness and pains. So these are some of the remedies that I think has helped. Similarly, even in the low back, if you find that there is a lot of stiffness and your internal medicines are not working and you would like to release the spasms, you can consider our homeopathic Gaulteria in 6 or 30 along with oil. Mix it with a little bit of oil and apply instead of internal, and you might get very good relief. Similarly, either with rustox or with, depending on the indication, take the indicated remedy and locally apply. That's been giving us faster results than internal.
So you give it internally plus externally?
No, either internal or external. Only one of the mediums work. And external is enough.
Okay.
If
So
you're giving external, if they're using it internal, then don't. If they are getting the relief, then don't change.
So it's a very, very novel kind of a thing. We all the time say homeopathy is very internal. So to get this kind of an input is like really useful. And
Yes.
you're saying that you get your workers to prepare these little things.
Yes.
You're saying you prepare it with petroleum jelly or something.
Yes. Yes.
So you put the mother tinctures in
Yes. Either mother tincture or 6C or 30, because we have indications for all potencies. So we can just prepare it in a small thing. So one small dabba will last for a week for that patient. And our medicines are not expensive, so it may barely cost us 30 to 50 rupees.
So for a fast OPD practice, and especially for you do lot of
For the kind of sir is telling, if it is occupational, it is an acute illness with a sudden onset and it is going to come down like a psoriatic illness, these kind of indications are good. And if it is going to be a chronic spondylitis aggravated by sitting for a very long period of time and or adding on to your poor work, the manner in which sir described, you're not putting effort on your body while doing this work, then our intercurrents like tuja, medorinum, and indicated remedies like silica, kalika, those remedies will help relieve the spondylitis, which will relieve the spasms. But that is a very chronic case. So it's that they have this illness from a long period of time. Due to the occupational hazard, it has become an acute exacerbation. Then in which case, go to your intercurrents and constitution. And usually higher potencies work better as pain relief.
Yes, so Anjali is going to give us some tips on how to handle this in other ways apart from medicines. Yes, Anjali.
Yeah, so
I'll just interrupt for a minute. One condition which I forgot to mention that time is carpal tunnel syndrome with prolonged use of the mobile, I mean the mouse. So in addition to medical treatment and other advice, I also give my patients a list of keyboard shortcuts, because if you use keyboard shortcuts, you don't need to use the mouse or trackpad at all. So that works. So Lata and Anjali, please cover this also.
Ma'am, Ruta 6C30 works wonderful for carpal tunnel. Use it for a period of 2 to 3 weeks if it is an acute illness. If you find that there is a tendency for this recurrent, then it becomes a constitutional problem. Then in which case calcarea, silica, those kind of remedies that also have an action on the muscles and the joints will also help. Otherwise, Ruta as an acute episodic illness, it's very good for carpal tunnel.
Yes, Anjali.
Yes, Anjali.
yeah, so sir and Lata ma'am have already given us good idea of what the issues can be and the remedies that can work. Now, what happens if it is too little for them to approach a doctor? So it is just starting. Can we give our patients some advice as preventative? So one very easy preventative is using, if for neck issues, is to use our breath and our voice. So if we are breathing deeply and if we raise our chin when we inhale and release our chin down as we exhale, this is a gentle relaxing for all the muscles in the neck. So just doing this regularly all through the day will help prevent a buildup. Second is to use the voice. So as we move the air up and down into in our throat, we also help release. And the vibration of the voice that we can do, it doesn't matter if we can sing well or not. Nobody cares about that. But the point is about getting the volume. So when we get a vibrational volume, that also helps relax the muscles in the neck and the face, especially when people are using their mobiles or staring at the screen, then a lot of tension builds up in the face and neck, which can also contribute to this spondylosis in the neck that will happen. So releasing all those muscles can help relax the muscles next to it. Because one of the few things that in anatomy we learn is how muscles next to each other influence each other. So sometimes if one muscle is too tense and too tight and no movement is possible, the wonderful exercises that sir talked about, which was moving the chin down and looking side, if it is too tight to even move the neck, then what can we do? We don't want to take allopathy. We can try putting some external massage. Of course, that will also help. But in the meanwhile, what can the patient do? So to involve your patient in their own healing, we have to give them some tools that even if it is a minute change, 1%, 2%, but if they can see that difference, they will keep doing it. And then once that neck opens up a little bit more, and then they're able to do some more exercises, then they will feel better. So we can start this at the 1% level. The second big occupational issue I am seeing with especially those working from home is not just low back pain, but sciatica leading to very stiff hamstring muscles because the knees are bent all the time. and those thigh muscles become very, very stiff. So they're not able to stretch it out fully. There are some very easy exercises that one can do just sitting in their chair. Again, we use the power of the breath. So when we inhale to open up the belly, and then as you exhale, pull the belly in as much as possible. And this straightens your spine. So if we just focus on breathing this way, then even if we are not able to get up and take a break, especially those working in high-end IT offices, where if they stand up or they move away from their desk, they might be looked down upon. So no problem. You don't have to leave your desk. You can be sitting at your desk, but you can still exercise. And that is just using the power of your ab muscles and your breath. The second easy thing to help stretch the hamstrings is, if you're sitting down on a chair, is to raise your foot up and straighten your knee and straighten your heel out. So you're pushing your heel out and you're pulling your toes back in towards you. And if you just do that one leg at a time, and you do it for about 15, 20 times every few hours, you will make sure that those hamstrings don't get too tight. And also you are working the quad muscles. So even if you're sitting in the office the whole day, you don't have time to go for a walk or a jog or a run, maybe you're not yet into a proper yoga routine, because all these things are the best things that you can do. But what if you can't do that yet? Then this is what you can start with. Just starting with a good breathing routine and just stretching your foot out. I've had two patients, both elderly patients, who were very unsure about doing any yoga or exercise because they were very scared that they will fall down or they will hurt themselves. So this is how I started with them. I gave them the breathing technique and said, whenever they're sitting in their chair, if they're watching TV also, no problem. They can sit in their chair, keeping their spine as straight as possible, and just do the breathing exercise. And that low back pain that they were having started coming down. They were able to stand up easily. They were able to move around a little bit more easily. Otherwise, that low back stiffness was making them hunched around all the time. And the second was the knee pain. So they were having swelling in their knees, which made walking very difficult. Of course, Rastox was prescribed. But if you give the remedy, but they're not ready to walk, then there's not much effect that the remedy is going to have. So how to get them to start walking was to get them to do this lifting the knee exercises. So they would just raise their foot up, push their heel out, stretching out their toes, and then bring the leg down. And just doing that 20 times, now they can move their toes, they can move their ankles, the swelling in the knee has come down 30%. And then along with the remedies, of course, then they feel better, that their confidence comes back to be able to walk again. Back to you, sir.
Ma'am, I just want to add two more remedies. If Ruta does not work, causticum, if it's chronic, repetitive with a stiffness, I've just made some notes. And hypericum, if there is tingling, numbness, and burning, like as if there is a nerve injury, then you might think of hypericum. And if there is, soreness and an acute injury where Ruta is not working, consider arnica. And Rastox, where even the slightest pressure, the inflammation is so much, the slightest pressure also causes pain. In causticum, it's like as if the whole thing gets contracted. And in Rastox, it is inflamed. But most of the carpal tunnels respond to Ruta. If they don't, depending on the indications, you can look at causticum, hypericum, Rastox, and arnica.
Oh, yes. And one more amazing exercise for carpal tunnel syndrome. This is a dance exercise that I learned when I was in school. And I have again taught this to many of my patients. In fact, you can all do it with me now. So spreading your hands out, you start with your little finger and move it in towards yourself. So we're going 1, 2, 3, 4, 5. And then you twist your wrist and take the little finger out again. 1, 2, 3, 4, 5. And move it again. So just doing this movement helps the fingers, it helps the wrists, it helps your forearms, and it helps the elbows as well. And for those using the keyboard all the time, for those using the mouse, for those using their mobile, this helps keep those fingers as agile as possible in reducing the stiffness.
Anjali, it was so nice seeing you do it very artistically. I tried doing it. It looked very ugly.
Don't worry. You keep trying. Don't worry, ma'am. After 1 week of doing it, I can guarantee you your muscles will all start opening up and you'll also be able to do it just like me.
I would like to add one more thing here. In cases of cervical spondylitis or just cervical abuse, what panics the patient is giddiness. And in today's WhatsApp university time, they jump to vertigo. And in our practice, they come already taking medicine for 3 days and saying no relief. So you have to give them some knowledge that the two parts in our body which take care of our balance are behind the ear. If your muscles are stiff, when you move suddenly, for a split second, blood doesn't go to that and it gives a wrong signal. It gives a signal to the brain that movement has occurred when actually no movement has occurred. So to tell them it's not vertigo, it's because of the cervical spasm and not that. Because again, talking to them, assurance is one very big thing because vertigo is very panicky thing, you know. A person suddenly feels I can't control myself. People have cried with vertigo, you know. Okay, I'll go to the next topic, Vishpala.
Sir, the remedy for cervical spondylitis with vertigo that has worked in our practice is gelsemium.
Okay.
So we've done quite a lot in this one topic, and one complaint. They've really covered everything. I think every delegate will be happy that they can handle this now so easily, including vertigo, because vertigo really gives you fear. Because people with they drive, they think they get vertigo. What will happen? They'll, crash the car. That is the greatest fear that they have. So if we can get that down, it'll be a big thing. Pain they can deal with. Vertigo is a bigger issue. Yeah. So that is very nice. And we'll go to the next complaint, Dr. Asrani.
Yeah. So we will take respiratory complaints. Respiratory complaints, upper respiratory infection, hypersensitive airway disease, or LRTI, low respiratory infection, are already increasing in incidence. But there are certain people who work in factories or professions which give air pollution, like people working in welding industry, where there are huge furnaces, people working in kitchens, then they start getting COPD. All the police constables who stand on the traffic signals are inhaling the fumes of auto rickshaws and cars throughout the day. So these people land up with major problems. In addition, there's another category, a salesman who's traveling either on a cycle or on a rickshaw throughout the day, driving 30, 40 kilometers, 50 kilometers in that dusty atmosphere, then he starts getting breathlessness. So basically, to explain them, proper diet to increase their immunity, avoiding it as much as possible, and then giving them rational treatment. Like people, when you give them relief, they come back to you religiously for a follow-up because now they are able to do their work without any hindrances of any kind. Of course, smokers, it may not be occupational hazard, but people working in big companies, doctor, I cannot think without a cigarette in hand. So you have to tell them that COPD is going to be the third largest killer in the world after coronary artery disease and stroke. So that is again, I would take it as smoking as an occupational hazard because that fellow cannot work without smoking. So then for him, that is occupational hazard. So I tell him, okay, hold a cigarette in hand, don't light it. Many times that works. Then I say, okay, you have to smoke, then don't buy packet, buy one cigarette at a time. Or roll your cigarette. It takes time, it's tedious. So you will say, okay, let it go. I will smoke after some time. And the frequency reduces. Now I will hand it over to both of you to talk on this subject.
Yeah. So, ma'am, I have just made some notes because in the place where we stay, we don't have so much of this hazard because a lot of them work in air conditioning offices. And most of them are the other musculoskeletal problems. But we did have some patients who tried to reach us out from this furnace industry and the silicon industry. So the silicon poisoning, calcarea, fluoric acid, silica, lipo. These were the constitutional remedies, and pulsatilla also. These were 3 to 4 remedies that I have used as a constitutional remedy. And sometimes these stone cutters, because we had these workers who work with granite and stone cutting and all, there also we found the similar set of remedies that work for silicon industry, calcarea, silica, lycopodium pulsatilla, also working. One interesting thing happened, ma'am, that one of our sirs here in Bangalore, he took the dust of that stone cutting and he potentized it, and he used it for those people because he felt that that can also work as a very good acute remedy. So because everybody cuts, like some cut granite, some cut kadapa, some cut different types of stone. So he felt we could consider this if the constitution is not working. For coal fumes, I have seen only one case where they had used carbonium sulf, and in one more case, carbo-wedge, more because of the symptoms of suffocation and air hunger. And I think, yeah, asbestosis also, I think we have seen in Bombay 1 or 2 cases responding to silica and lycopodium. And most of them, I think, they find that remedies like silicon, only one other remedy was conium. Conium, silica, lycopodium for asbestosis. So these were the 3 to 4 conditions in my clinical practice, little bit what I have been exposed or what my sirs have done, I'm sharing.
Thank you very much. That's very useful. And also that you could potentize and you found some results that also.
Stone cutters, definitely, he has tried that because they get a range of patients. It's not just the persons who are sitting in air conditioned office. They also get these workers, and they have definitely found it useful. Acute, and then they follow it up with a constitution, because this is a constitutional tendency. Not every stone cutter develops this illness. Some of them are a lot aware. That speaks of the constitution. They cover themselves, they take precautions. That speaks again of the constitution. Some of them are not bothered. So again, it becomes a very constitution. And usually these, if we know that this range of our remedies also cover COPD, then it works wonderfully well, like silica, pulsatilla, lyco, conium, and others.
Wonderfully means the COPD, the symptoms reduce. How much we can reverse that?
No, depending on the grade, ma'am. Grade 1, initial, reversible, we can give relief. Then as it progresses, we need the help of the other systems of medicine, and we are just supplementing whatever is possible through a chronic deep acting remedy just to sustain him to a functional zone. We are not talking about cure, ma'am. In an advanced case of COPD, where the structural and irreversible damages have happened. And there, even the potentized medicine will not work.
In COPD cases, what I have seen is that whatever relief we can give, the patients are so grateful because
Yes.
nothing really offers them any relief.
Correct.
So whatever little relief, I've had patients, the mother died of COPD finally. She was some 35 kilos. And he came and presented me a watch for looking after her. So, just that, so she could live a little comfortably.
Correct.
Yes.
Yeah, when we are exposed to these kind of external factors that are actually causing the illness, prevention is the biggest cure here. Because as Dr. Lata was saying, once it has gone into stage 2, stage 3, there is no cure. We can only manage the symptoms a little bit. So if we can implement a system in all these professions, in these factories, because these systems are easy and inexpensive. The first one is using salt. So salt and water together, so warm salt water, using it to clear the nasal and the throat passages. If a person working in such environments does this every day, then the amount going in and out is going to be minimal. They can help reduce the amount of dust that is going in. Second, of course, is to do Kapalbhati. So those of you familiar with yoga and Kapalbhati, it is a forced exhalation. So if they can take a break every 4, maybe 5 hours, come out, rinse their mouth and do the Kapalbhati, which is, for those who don't know, I will demonstrate it for you. So it's a quick, short, fast, just like our aphorism about cure, but it is about exhalation. So it goes like this. So really rapid exhalations, and this clears out the nasal passages and pulls out air from the lungs. So this will help dislodge any bits in the lungs that are stuck in there, and with the help of the mucous membranes can pull out a lot of the larger particles. So doing this regularly will help reduce the load on the lungs of these foreign objects. Third one, also which will help, is to help clear out the nasal passages with oil. So this is an Ayurvedic technique. They call it oil pulling. They can do it both with the mouth and the nose. So you can use a cotton bud with oil and scrape the inside of the nostrils and pull out whatever may be stuck over there. And also swirl the oil in your mouth daily, morning and night. And again, as that oil goes in over there, it again picks up any small particles and absorbs that into it. And then you spit it out. So this can be an easy and inexpensive way, especially for those in jobs which are more menial workers and less office workers, to do this and help reduce the COPD. Now, another interesting cause of COPD that I have come, which I did not realize could be a cause, is obesity. So I had one patient who, because of obesity, had ended up with COPD. And that was just about to lose weight, and they just were refusing to change their diet. They're like, no, they want to eat their pizza and burger and fries and all of that. They didn't want to change their diet. They were like, I want gastric surgery. And I was like, sorry, I can't do gastric surgery for you. I'll give you constitutional medicine. But what can I do to help you breathe better? There are points on our fingers. So this part just below the balls of your fingers over here, this is the lung points in both acupuncture and reflexology. So if we massage these points over here, they can sometimes help release the tightness in the chest and the lungs. This is also great to use with babies and children when you don't want to give them the inhaler or the remedy is not yet, you're able to find it, or it's the middle of the night, they can't go and pick up the medicine. Then what can they do as an emergency is to massage these points. So on both hands, just this line over here is the lung area. And the tips of the fingers is the sinus area. So sometimes because of COPD, they also get sinus congestion and nasal congestion. Then releasing that at least will give a little bit of relief. So here we are using as much as possible all these side issues. The third, another one that I would use is supplements. In COPD, I find this works very well. And that is both vitamin C and vitamin D in high strength and frequently. So taking this helps boost our body's immune system a little bit, and that helps relieve the pressure on the body that this lack of oxygen and the poor quality of our lungs is causing to the body. And that can be one way again to support a patient. Back to you, sir.
So
I will, Vishpala, 1 second. A word of caution. Kapalbhati is a very good exercise, but make sure your patient does not have any heart condition. People have died during Kapalbhati because it puts a tremendous strain on the left ventricle. So if you already are a case of heart failure or fluid collection in the lungs, then Kapalbhati is going to be very bad for you. The simplest exercise which I teach is pranayam, controlling your breath. So, what I teach is very simple. Purse your lips and take the deepest breath possible through your nose. Then step 2, hold as long as you can. So if you take 4 seconds to take a deep breath, you hold for 6 to 8 seconds, and then you exhale through the mouth so that your lungs are totally empty. It doesn't put any strain. Yes, if the person is young, non-smoker, heart is fine, Kapalbhati is a good exercise. Yeah, Vishpala, you were saying something.
was saying that, there is a practice of what is called Jalneti. But and earlier in the earlier times, it was a little difficult to do with a thread and all. Now you get a pot, and actually, I have been doing it for the last 10 years on a daily basis, and I keep that pot and the salt and the soda bicarb all in the bathroom. So all you have to do is fill the warm water, put that. Only there's a technique to it that your head has to be properly down on the left side, and otherwise it goes in throat and you feel choking. And for children, the mother should help to hold the head down. And then it is like magic. They also enjoy it because you put water through one and it comes out through the other. So if you do it the right way and every day be with them, because they can't remember how to hold the head down. And then it keeps, you just have to explain that, it's like bathing, you do everything. So you have to clean up the nose and the throat also. And then they are okay. But why do it every day? I have no trouble. Why do you have a bath every day? You have no trouble. So same way, and this takes, actually I've timed it, it takes only 55 seconds. So, so it's a very good way of keeping it. So now we move on to our third topic.
Now my third topic was actually stress. But I just thought that we have 25 minutes left, and it will be injustice to stress to cover it in 25 minutes. So I request that NJH should arrange either a webinar or a roundtable purely on stress, the physiology, why it causes problems, why it can cause virtually any illness, from rheumatoid arthritis to asthma to sinusitis, and then ways to deal with it. I will go on to the fourth topic on my list, is gastrointestinal problems due to job or profession. So the problems are multifold. One is hyperacidity because of irregular meals. People will say, my boss is so rigid, he continues meetings till 4 p.m. from 11 a.m. and we can't break. Secondly, smoking, alcohol, and junk food because of work. I am supposed to leave office at 6. I have to stay till 9. So what I get from outside is vada pav or chips. So hyperacidity, GERD, and constipation. Doc, I have an urge, but when I cannot go because I'm in a meeting, so I hold on, and then that leads to constipation. And similarly, it leads to urinary problems, because if people can't leave meetings to pass stool or pass urine, then the bladder acts funny and then they start getting urinary infection. The elderly people above 50 may start getting incontinence and all, but gastrointestinal, this is the biggest thing. Of course, stress will lead to IBS, stress will lead to other things, but basically not having food on right time, not having the right type of food, not evacuating regularly are the problems that people come up with related to their profession. So again, they need some kind of counseling. They need to be explained that medicine alone won't work. It's not magic. You have to do lifestyle management also. And then what to eat, what not to eat, what small eats to eat, all that thing has to be trained. Now I hand over to Lata and Anjali for next 20 minutes to regale us.
But you know what, I just want to ask a question here.
Preeti, are you there? You have to unmute Lata. Lata, you can
Yes,
unmute yourself.
Yeah, she can do that.
So,
Yeah, I have unmuted, sir.
you can't see.
You can see me, ma'am?
Yeah.
Yeah. So what I want to ask is, this office problem, there has to be some solution to it. Has anybody given some thought that somebody talk to the boss? I mean, so many things that need to be done. They cannot do it. Even for their own health, the bosses' health is not good. So somebody needs to, talk to them. Is there anyone who's found a solution? I
Bell
tried.
the cat. Yes, it's difficult to
Ma'am,
bell the cat. Yes,
Yes.
especially when it's MNCs who are running on timetables which are not Indian timetables. People are working European time zones, American time zones, or East Asian, Chinese, Japanese time zones. So how will they have a healthy life if they are not in the normal circadian rhythm of the land that they are living in, despite which land that they are working for?
ma'am, I have found there was a case where the patient was having gastritis with sleeplessness because of this night and day shift. And what I found is empowering our patients to understand the consequences of these times on their body allows them to negotiate without fear and anxiety with their peers and the bosses that this is the place and point at which I can work, and this is as far as my body travels. Dave, dear?
But how do you do that?
So, ma'am, we had to go through counseling. So, the constitutional medicines used to go on, and natrum silicata was the remedy that was given to that patient. And counseling required both immediate factors that are causing that immediate challenges that he faced was lack of sleep affecting his acidity, cholesterol, and sleep patterns, which required him to negotiate with the boss without any fear of being thrown out. The second factor, a lot of them in their developmental years have this feeling of not being good enough, need to prove, and a constant need to get verifications and approvals that do not give them the courage. Therefore, you find those kind of remedies also coming in. And they do not have the courage to stand up to the system to say that this is as far as I can go, because there's a constant fear that they have to prove or they will be thrown out. There are so many anxieties and fears which require them to go into a very core healing of where did this stem from in your childhood? What has driven you towards work? Why do what is your motivation and passion behind this work? So a thought analysis question, we give about 10 questions, which is called the thought evaluation process. At the end of the 10th question, they should be able to realize that there are other lateral ways of solving my fears and my inability to talk than this one particular pattern that I have followed. The internal remedy, most of the gastritis remedies respond to chronic deep acting remedies like Kalibai, lycopodium, or even hydrastis is being now been trying to use as a constitution. And our usual medicines, ma'am, natrum, phosphorus. But along with it, if we go through this processes of finding out from their childhood what has caused this kind of fears and anxieties, what is motivating them, why does it block them, and then at the present, make them aware of the consequences of these actions, the immediate requirement action plan. Both these action plans, if you put in your management, what we call planning and programming, I'm sure you will be able to deliver the results where due to these kind of timings which are self-imposed on them, not eating on time, not sleeping, I don't think permanently we can keep them on medicines. The medicines must bring about an internal healing, as well as the second part is we should also be able to relieve that from where did this fears and anxiety stem in.
That I'm very happy you handled this. But the thing is, supposing a job requirement, as stated, was this, that you work these hours, okay? So then after that, you can't go back and say, no, I don't want to work these hours.
So, ma'am, the body does not understand day and night cycles. So what will be required is, if he is going to work in the night, then he will have to change his circadian rhythms to understand that how he can modify his body circadian rhythms. Like the day becomes the night for him and the night becomes the day for him. And that requires, ma'am, some of these things that I found, like just blackening your eyes, darkening the room, and creating an atmosphere for the body to feel that now it is, this day is for me night. If you're really helpless and you cannot negotiate your timings, then you will have to change your circadian rhythms, which are photosensitive and light sensitive responses.
Thank you, Lata. So that we can help ourselves change with, that rhythm inside you. There is even a machine.
Circadian rhythms, ma'am, it's a very beautiful, if you go to the Google, you'll find very cute 2.5 minutes videos which tell you, which is like a liver is a night owl. Asrani sir has also given us those very cute videos that explain which organ works at what time, and basically all of them are sunlight sensitive, and now we are making them photosensitive to artificial light.
Nice, very nice. So we have Anjali now going to tell us what you can do to change these rhythms. Yes.
Yes. So what both sir and Lata ma'am were talking about was, not apart from those remedies, one remedy which I'm sure Lata ma'am wanted to have said but maybe missed out was Naxwamika. And I use Naxwamika all the time for patients in similar situations where the sleep cycle as well as their food cycle has been disrupted, and then the resultant hyperacidity or GERD or nausea or even stool issues, especially constipation that sir mentioned, comes. So Naxwamika works beautifully as an acute, irrespective of whatever the chronic medicine constitutional is. And in low potencies, it can help stimulate the liver, and that can be even used long term. I have used Naxwamika for a patient in a 60 potency for 3 months together, because they were going to be traveling and moving different time zones. And I knew that if I just gave constitutional, that would not be enough, because the what is that word? Sorry, my brain just went blank over here. Occupational hazard of being a homeopath. We have to know lots of terms. Yes, the maintaining cost. So the maintaining cost for this patient was the travel, so that maintaining cost is going to be there. So cure cannot happen. So I gave them Naxwamika for the 3 months of travel that they were going to be doing across 3 continents and 8 cities. And it reduced their symptoms to a large extent. So they still had some of it, of course. They could not completely escape. But having the Naxwamika every day, irrespective of what the time zone outside was, just taking it every day helped their body adapt to that stress that their bodies were going through. But from a food point of view, what I have found that works really well, especially for the office workers who are doing these really high stress jobs, is to carry a flask with either hot somph water, which is fenugreek seeds, or jeera water, or a combination of somph and jeera. And having that flask throughout the day and keep sipping that water reduces the acidity. So even if they skip a meal or the meal has become too late, they're able to drink that during their long meetings, or they're able to at least have a few sips of it in between whatever deadline that they're working with. Then even if they have that meal at 4 o'clock, and if they eat a little bit less at that time, they can avoid the terrible symptoms of the burning acidity. Another very good thing to do as a practice to help with that morning evacuation, to help prevent the constipation, is to drink hot water with 1 teaspoon of ghee in it and 1 teaspoon of honey in it. So warm water and honey or hot water and ghee. Either one of these can really help open up the bowels so that in the morning, before they go off to office, they have cleaned their system and they don't have to worry about it later. And this can be done even later in the evening. So they can't do it in the morning, but are coming home in the evening and need to evacuate them. Same thing, because the moment you drink the warm water with the ghee or honey in there, within 20 minutes, you will need to go to the toilet. And that is a lovely way to physiologically help the condition and clear it out as much as possible. The third one, which you talked about, which was the circadian rhythms, apart from Naxwamika, using what is called a sun lamp can also help. So you get these, again, in various online stores, and these are small lamps that help create artificial sunlight in the room, and they slowly brighten and slowly dim, and this helps stimulate the melatonin in our body to mimic as if we are going to sleep and then gently waking us up. So it is never a shock to that body. So the less we shock our body, the more comfortable it is to deal with these changes. So this can be a nice way, especially if they have a little bit of money, to deal with an issue like that. Another one as well is wearing an eye patch and massaging the temples. So when we massage this area over here, we release a lot of tension that is sitting in the muscles going into our jaw and our face, as well as our forehead. And that can help make us sleepy. It's a very soporific massage. These points over here, as well as these points on either side of our nose. So this opens up the airflow to the sinuses, allowing more oxygen to go in. And this can also be a very calming and soothing effect. So a lot of high tension days at the office, you come back, you still are feeling that tension, the adrenaline. What sir was talking about stress. You can always do this in full detail in another session. But yes, these are easy points to help just relax. And then there is one point here, right on top of the skull. Now, all of you can do an experiment now. Just touch the center of your skull. And you might feel a little bit of pain when you do that, just a little bit of tenderness. But if you just keep pressing and holding it, you will find the tenderness will slowly fade and a kind of relaxation that goes down the back of the neck to the base of your spine, all the way into the coccyx. And this helps release it. So this line of points, starting from the tip of above your nose over here between your forehead, and this line going up to the center and to the back over here, these are where all the reflexology points of our body converge. So the nadi points we talk about. There's 72,000 nadis. So of course, we can't get all 72,000, but a majority of them converge at these points over here. So daily massage of this line over here can help just balance those points and release any of the tension, headaches that can be associated with a lack of sleep, as well as in tough deadlines, as well as the hyperacidic headaches that happen in remedies like Naxomica and Bryonia. And this can just help release that. So in the middle of a meeting, they're not able to go and take the medicine. They can just sit listening to the meeting and gently just, yes, sir, of course, boss, and something like that they're talking about. They're just pressing that over there as they are talking, and that can release, as well as the points on the thumb. So again, this can be very discreetly done while sitting in the office. It is just pressing these points. So top of the thumb over here, anywhere along of them. If they can just keep pressing their points, this releases a lot of heat and tension that will be sitting in the upper part of the body, in these head points. And releasing the heat and tension of the head points helps relax the body. So then that extra acidity that can go and hit that head, we can help relax that a little bit. The stomach points are here at the base of the thumb. So the nausea, hyperacidity, burning in the pit of the stomach, tension in the stomach, all of that can temporarily get some relief by pressing these points over here. Right, back to you, ma'am.
Ma'am, I just have one tip. I have found that a disciplined diet routine where we could consider the lemon juice that Anjali has said, and then start with a bowl of fruits to increase the alkalinity of the stomach, and then followed by, if possible, 2 meals, where the meals start with a salad and then go on. Even trying to go vegan if you're finding your stomach is milk sensitive. And also having nuts at 6 o'clock. Walnut is a melatonin. So you schedule your food in such a way that you have the morning bowl of fruits, and evening at around 6 you have nuts and an early dinner, and try to walk 5 to 10 minutes after the dinner will provide you a better healthy bowels.
You know,
Thank you, Dr. Lata. I'll add one more point over here. When Dr. Lata mentioned that, I remembered. So especially in the West over here, there is a big fashion fad to have smoothies every time. And that's usually mixing fruit with either yogurt or milk, which both are absolutely bad for when anybody has acidity.
Yes.
Because that causes an increased acidity.
Yes.
So fruit should never be mixed with any protein substance.
Yes. It should be
either
just
pure fruit,
bowl.
yeah, or just the milk you have together. So if they're able to differentiate that, they will reduce it instead of thinking, oh, I'll have a cold milkshake, it will help my burning acidity. Like, no, the sugar is not going to help your acidity. You can have chas or dilute yogurt plain by itself or with a little bit of jeera powder, but if you do anything other than that, you are going to worsen the acidity.
Especially fruits are best left on their own.
So actually, I follow a fairly good diet overall. And I begin with 2 glasses of water right at the bedside, which is one hot, one thing kept there. So before even getting out of bed, people say we don't have time, but you start that, your process starts, and by the time you reach the bathroom, you're fine to go, clear up your bowel. But so what I have done is say, this is my schedule. I've printed it out and I give it to them that if I can do it, so can you, kind of. And then I have my 5 fruits and whatever else I do. So it's all written down. And some of them, if they follow it, it'll be good. But yeah, we have to just try our best. They always say, yeah, we did it for some time. Then we gave it up. It's not so difficult once you set your mind to it, and if it keeps you kind of healthy. So I must say this has been a very nice session today, because actually it was a very difficult topic and we have converted it into a very interesting, useful, and usable. Everybody can use so many of these things we talked about so easily. Just that we never thought about it, just that we never did it. So all you have to do is work it into your schedule and you will be able to do it. So I must thank our 3 panelists who have done this great job of converting a topic which everybody was scared even to take up, and made it so wonderful.
We have 4 minutes, so 1 point extra to these people who say no, that my meetings go long. I tell them that now, if you're working there for some time, you know how stupid your boss is or how rigid he is. So before you enter a meeting, you have a fruit or have 4 biscuits. Then you can pull on till some time, And also I have seen that if you tell the boss correctly, gently, don't say about yourself, say, sir, the team needs a 10-minute break. And the best way to say is I tell them, say a bio break. So at least the boss will think a good word has been used, so give me 10 minutes. So basically anticipate the long journeys. Okay? That's all from me. Thank you.
That's all from all of us. And we have almost be on the dot of time. We began on the dot and we finish on the dot, which seems to be an NJH motto which we aim to follow every time. I want to thank Dr. Asrani for leading this, and Dr. Lata from Bangalore, and giving all her experience of working in the field and sharing it with us, and these little tubes which we didn't think of maybe. And Anjali from London, who does much more work with all these other modalities, coming in and putting it all together for all of us and for all of you. Yeah. And do write in how you found it. If you found it useful, do write in on our Telegram chat. It would be nice. So thank you very much. Thank you all. And we will meet after a month for the next round.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you, everyone. Bye.
Bye. Bye.